Hello everyone, greetings from Storycorner at Bookmine, and we begin a new series for adults that is called Stories of Hope in the Age of Corona. We all know that we are in the midst of a second wave that's raging on, and people are struggling to get a bed, to find medical oxygen, to find ICU care, and in the midst of this very difficult scenario, it is heartening that there are stories of hope and there are people who have emerged as good Samaritans. About 15 days ago, when a 60-year-old patient was told that he would have to leave the hospital because they had run out of oxygen, his family was at their wits' end. They just did not know where to move him and how to find the oxygen that would literally keep him alive. It was here that Kadamai Educational and Social Services Trust came to their rescue. Now this is an NGO which was primarily working in the fields of education and health. They have a medical center where they had regular blood donation camps. They provide financial support to needy children who are in standards 5 upwards. They also worked a great deal in the area of women's empowerment, helping them to become more employable by giving them spoken English training, computer training, and lots of other skills. And when Corona and COVID-19 happened, they had to completely rethink their priorities. They started out in the initial stages by supplying groceries and other required sanitizers and other things to needy families. But then in the midst of the second wave, when there was this dire need for oxygen cylinders and hospital beds, they quickly came up with an idea to convert 2 of their autos into auto oxygen ambulances. So when there was this call from the patient who had been told to find another hospital, luckily for the patient's family, they got in touch with Kadamai, and Kadamai came to their rescue and quickly provided the much needed medical oxygen support to the patient, and didn't stop just there. They helped the patient and his family identify another private hospital and made sure that he was admitted there. Now this is only one of the many heartwarming stories that Kadamai has to share. There was this story about a patient who was being ferried to a hospital in an ambulance when the ambulance ran out of oxygen, and they quickly got in touch with Kadamai, and Kadamai came in to help keep the patient going, and then he was taken to the next hospital. There have been SOS calls from patients in homes where they find that their oxygen saturation level has been dropping dangerously low, and Kadamai's team goes to the homes of these patients and provides the necessary oxygen supply till the levels come up and the patient can be moved. Now they are based in North Chennai, and they operate only within a 15-kilometer radius. And this service is being extended to patients who are able to sit in their autos. Now they have 2 autos which are equipped with 47-liter medical oxygen cylinders, and they have 6 volunteers who ferry the passengers, all togged out in their PPE kits and wearing the necessary protective gear. The patients are also taken care of suitably, and the necessary help is rendered absolutely free of cost. While many patients are willing to pay something or just about anything, Kadamai does not take a single pie and renders services absolutely free. Nearly 400 plus patients have benefited from Kadamai's services, and this is an NGO that was founded by C. Vasantakumar, who is the founder secretary of the trust, along with his core team. And as for the oxygen, one of their volunteers is attached to an medical oxygen supplying agency, which is why they are able to get their refills on time. And a 47-liter medical oxygen cylinder can support about 25 to 30 patients, and so they service about twice the number of patients in a given day. They receive far more calls than they actually service, but given the constraints, they are only able to do this much. But they have also tied up with other NGOs. That is what they are beginning to do now, and they are willing to offer technical support and other assistance to any other NGOs who are in possession of autos and who are willing to offer their services. Now the autos in Chennai cannot be missed. Any tourist, Indian or foreign, knows these tuk-tuk vehicles. They are warned to be careful of them sometimes, because some of them fleece passengers, but you cannot deny that they know the city and all its nooks and crannies. And now an organization like Kadamai, which means duty, has completely changed that perception, and has proved that an auto oxygen ambulance can, in these difficult times, make the difference between life and death. Kadamai, Vasant Kumar and team, may your tribe increase.